also have a research. You know what? We also have a research arm that has a whole research agenda. So just because it doesn't exist doesn't mean to say that somebody somewhere can't prioritize it as a policy or capacity building action. So be creative. As a team, afterwards, and I'll say this at the end of the day as well, we will sift through, do the analysis, turn these needs and ideas and gap analysis into something that looks like recommendations for policy. So don't worry about all of the wording. There's a very skilled team behind this that will help us all get there. And then it will go out for validation and any tweaks to the almost 80 organizations before going in. So that actually it's not just a case of, well, there are some nice proceedings. It will have the weight of our community. So be creative as we move through. Okay, so I think I am almost able to hand over. Oh, yes, I forgot to say, so as of yesterday, as we said yesterday, don't forget, we're recording. A note to everybody, see those green lights above you? Those are microphones. They will pick up any side conversations that you're having, even when you're whispering. And people online will hear those side conversations. I can't say it clearly enough.
As someone who was online yesterday, I can confirm that is the case.
What we will do, so understand, this is meant to be a safe space. Keep it safe from that perspective. We will also be wandering through with microphones so that, again, people online and everybody in the room can actually hear and contribute along the way. And for those online, welcome. So this morning, please chip in. We have our colleagues Bridget and Tom, who are keeping a very close eye on what's going on online. So we'll bring in your points and, as necessary, also try and get you up on screen. So if you're still in your pajamas, put on a decent top. Okay, so keeping it real. This is also a safe space. So Lisa, where are you this morning? Great. So our colleague Lisa from EFA is there. In case anyone feels unsafe, triggered, for those of you who were in the room and online yesterday, tough discussions. I don't know what's going to happen today, but just in case, Lisa is there. Any insensitive remarks, 0 tolerance, removal. I doubt that will be the case, but if it is, understand that's how it will go. And again, Lisa is there to process all of that at the time. Socials, I follow Twitter, X platform. I saw we started posting. Take a photo if you haven't already. This page is not coming back. So if you, or when you want to, post on LinkedIn or X, then you can also use the hashtag health equity disco. I also saw race discrimination and things like that, but these are the 2 big ones so that it's connected in our feeds as we move forward. Okay, so with that, I am delighted to get started on the deep dive on all that is data. I'm so excited about this. No, and I'll tell you why. I know people always think, just why? Okay, so I know because I mean, I will admit I did cry when I had to do my first stats course, I will admit, but that's actually because it was so abstract. And what we're going to go through today is actually how do we make how do we measure success? What are the indicators that we need to be able to say, actually, what we want to get done, we can actually measure? Because again, in policy world, if it's not measured, or we need to know what we're measuring, it doesn't exist. And we'll also, during the course of the day, also have some case studies of how this is being made almost real time, so world of real world evidence, and what are the pros and cons and pitfalls of all of this. But in the first instance, I'd like to hand over to Mila.
Thank you.
Who is going to, from OHCHR, who is going to talk us through what are the indicators, and I do believe work with us as well in an interactive work session.
Yes,
Wonderful.
thank you very much.
Mila.
Thank you. Now, well, I don't know from where to start. First, the idea of having specific workshop on data and indicators has been discussed for quite a while and observed as something very necessary in all the spaces that the anti-racism coordinator is organizing. Thanks to them, and thank also to a lot of spaces where we have been invited, including the Romani Week, for example. We have been consistently receiving the request of delving more on the topic of human rights indicators. And we decided to make an experiment, honestly, with IFA and with the Hofner and with Article 1 to add one specific day on data and indicators and see how it goes. Because usually those type of spaces are organized only for one day. And we see already we have less people here. And what I'm going to do now with you is to share the OHCHR, the United Nations High Commissioner for Human Rights Indicators Framework, a little bit the history of behind the creation of this methodological framework. Also try to, many of you are here statisticians, but many of you are not, and also try to a little bit disperse this fear around statistics. People usually don't find the topic attractive. I think those of us who find it interesting are perceived as not the mainstream profile working in the field of human rights. So I would really like, during my presentation, to give you a lot of examples and to invite you while I'm speaking also to have a look at the document that I shared with you here, a list of illustrative indicators, and really try to think of the topic more as interested human beings. If I'm discriminated and if I'm victim of human rights violations, how would I like my case or the case of my family or the case of my close circle of relative friends, etc., be reflected by responsible institutions in their administrative registries, let's say the justice administration system, the police, the prosecutor, the health system, the educational system, but at the same time preserve my anonymity. No? More or less, this is what I'm going to invite you to think at all time and not to think so much about the statistical concepts behind the topics that I'm going to be presenting here with you. And then later on, we have a lot of spaces because 1 hour, I know that it's not enough for everything that I would like to cover. We have a lot of spaces in the afternoon to have this interactive discussion with you that partially started yesterday, for example, related to the conceptualization and operationalization of race for statistical purposes. Okay, not for human rights purposes, but for statistical purposes, we need to operationalize race, okay? Independently on how the medical, biological, human rights discourse has been moving forward. If we want to record what is going on in the field of racial-based discrimination, we need to reach some common agreement of what are we going to put in the column, whatever, of my statistical system. So this is something that we would like very much also to invite you to think collectively here, also considering the fact that we have representatives of many different countries. No, this is something that we're going to do in the afternoon. And of course, the space is designed very much to strengthen also the voice and the weight that the Commission has as an interlocutor with national states. No, how much we can join forces and reach, for example, the government of, say, whichever country, let's say Romania, let's say Bulgaria, let's say other countries that are usually not mentioned very much in the context here because we don't have representatives there. How can we reach those countries and collectively, with our support between civil society, international organizations, Commission, academics, join forces in transmitting a common shared message on a EU justice administration system. You can improve your data registration system following this criteria here. Now with this, I will start. I don't know. Where is it? What? I don't know how to. There. Okay. So OHCHR, as an office of the High Commissioner for Human Rights, has been tasked many years ago. It was around 2004, 2005, when the discussion started, was charged with the task of coming with a conceptual and methodological proposal on how to measure human rights and bring this proposal to all states that have signed international treaties and support them in their reporting exercise. So this is something just as a background that I wanted to share with you. We have many international treaties, many international normatively binding documents, out of which I always like to stress which are the 9 core treaties related to economic, social, cultural rights, related to civil and political rights, related to violence against women, related to the elimination of racial discrimination, because there are many other treaties, and I don't want to convert this as a talk on international normative framework, but just to stress here that any country that signs an international treaty has an obligation to report how they're implementing. Okay? Those are normatively binding. I think some of you with whom we coincide many times in those events are probably already tired of hearing me repeating this, but this is something that is very much missing at the level of public policy, development and implementation at EU level and also in European Union and non-EU, but European states. When we stop having the international normative framework as a core reference on what to do in the area of human rights, we are also stepping aside from the discussion on how to measure human rights. And we leave a lot of discretionality in the hands of national statistical institutes or individual institutions from the executive or from the judicial power of different countries to decide what to measure and how to measure. So we really need to have also make joint effort and to join forces in reminding states that they have normatively binding obligations to report at least to these 9 core treaties. Okay? So we have the International Convention on Elimination of All Forms of Racial Discrimination, which is the oldest one, and then the Covenant on Civil and Political Rights, Economic, Social, Cultural Rights, etc., etc. Now, what happens in 2004, 2005 that I was mentioning to you, when states report on the level of implementation of their international obligations? Remember that this is compulsory to do. States, what they usually do is they present a lot of narrative inputs because they were guidelines established many years ago. No, what states should report. But regarding what the statistical input to these reports should be, there were no guidelines established. So the committees that monitor the implementation of those treaties. You have heard, for example, the Human Rights Committee that monitors the implementation of the Covenant on Civil and Political Rights, and the remaining committees, the CEDAW, etc., the third committee. They discover that states report with completely different criteria and completely different input that is not necessarily coherent from one reporting period to the other. Therefore, it's rather impossible to draw some sort of conclusion on how the level of implementation of human rights is being observed from one reporting period to the other. So if you don't have a measurement instrument, if you don't have a well-established scale on what we want to measure, we cannot compare progress. That's it. I think it's pretty easy, the conclusion that we're drawing here. So the High Commissioner for Human Rights is charged with the task of developing a methodological framework and a proposal of illustrative indicators. And here I underline the word illustrative, because what you see here in the photocopies that I have shared with you are the minimum contents that have to be operationalized for statistical purposes, translated into variables that can be recorded, with which the indicators can be constructed later on 15 altogether: economic, social, and cultural rights, environmental rights as well, and civil and political rights. And those illustrative indicators later have to be taken by each country institution and be contextualized for the reality of the specific country that is going to implement the methodology. Okay, so the High Commissioner for Human Rights starts doing this methodological proposal on what to measure and how to measure back in 2004, 2005, and ratification status. This is not so relevant, okay? And comes with a proposal on human rights indicators later in 2008, okay? One big problem that we have as United Nations system, unlike the system of the Inter-American system, is that the indicators framework that was published is not normatively binding, okay? I'm sharing this very honestly because usually the question is, okay, if this was produced for reporting to treaty bodies, why states are not doing it? Because there is no normative obligation to do it. So this is, let's say, the annex to the 9 core international treaties and remaining normative framework that we have. So here, unfortunately, we fall in the hands of free will of states that have to decide, do I want to implement this normative framework or not? Now, what happens behind the scenes, however, is that when states are submitting their reports to the different committees, the committee members are examining the information that they are presenting under the lens of our methodological framework. So later on, when they start producing concluding observations and recommendations to the countries, and the body of recommendations on data is extremely high. There are over 800 recommendations on data and indicators related to race, racism, discrimination, exclusion, ethnicity, Roma, people of African descent. I will show you where you can search for those. These are public databases. You should bear in mind that those recommendations are formulated already under the understanding of the committee members that states must implement those, okay? I cannot tell you what is the reason of why this is not made normatively binding. We hope that eventually one day this can be the case. Now, what is happening in the American states that are part of the Inter-American Convention for Human Rights and, for example, the follow-up of the San Salvador Protocol on Economic, Social, and Cultural Rights? They have the same methodological framework as ours. The Organization of American States builds upon OHCHR methodology with very, very small differences and makes it compulsory its use for the reporting of 30, how many they are? 37 American states we have, or 34? What it is? 34, 37, more or less. So 30 states, more than 35 states are obliged to report with similar indicators framework. You will ask me, why are you bringing this to the conversation here? I'm bringing this to the conversation here because we have huge input coming from Latin America on how both methodologies have been implemented. So the first rights that were conceptualized and measured in many Latin American countries are the rights to health and education. So we have the illustrative indicators contextualized for many countries on health already being implemented since 2010. And this is an experience that can be taken more or less, let's say in some 80% by EU member states, and with very small changes be adapted to the health systems here and be used for monitoring and reporting. In other words, we can save around probably 9-10 months of work in conceptualizing how to measure the right to health here in Europe. A lot of work has been done. Yesterday, it was also part of our conversations. Now we have to start looking outside of the European Union, what has been done in many, many areas. No? So this methodology, I was going to come back, okay? For what also it serves, no? To respond to this, here they are, 1,580 recommendations, and this is the number that I made a couple of months ago. They were more countries examined by the CERT in January, in the period of January and April, if I'm not mistaken. So this number is already higher. This is number that refers only to EU member states, okay? By the CERT committee, by remaining committee, by special procedures, and by universal periodic review on data related to racism and ethnicity. So here we have 27 EU member states that have to comply with this number of recommendations on data and statistics. And all of them, if you go to our databases that are public, all of them more or less say exactly the same thing. And the thing that they say is, on one side, you need disaggregated data. And we all know that disaggregation of data is not the only thing that we have to do in order to record well the issue of racism in Europe. And another thing is generate new indicators. Not only disaggregate available statistical data that we have, but also start inserting in national statistical institutes and administrative registries on all human rights possibilities to measure issues that we are not traditionally measuring. Okay? This is what the body of recommendations on data and statistics is saying. I'm going relatively fast. Usually the content on the methodology can be extended to courses up to 30-something hours with a lot of statistical focus as well. I'm mentioning this for those of you who might be interested in receiving more detailed knowledge on what to measure and how to measure. I don't know why this is longer. Okay. And here I wanted just briefly to mention why do we need the human rights indicators? Now, what was the idea behind the development of our methodology? The first thing is the methodology is translating international human rights standards into measurement models that can directly serve for nurturing public policy. Okay? So one of the first messages that we're transmitting here is you cannot develop public policy without having at least some sort of nationally established, and I insist on the word nationally established, baseline on the concept that we are going to measure, be it racism, be it health, be it education, be it the situation of migrants, whatever we are supposed to address by our public policies. Okay? The second thing is through this framework, you can strengthen transparency and accountability mechanisms. Usually states do not report back to their citizens what is the level of implementation and the impact of the implementation of public policies. And the third point is for the implementation and the follow-up of recommendations on human rights mechanisms. There again, European states fall very much behind what other countries around the world are doing regarding the implementation of international obligations and international recommendations. I will give you one example. All states are, these are, let's say, the soft law required to have national mechanisms, established national mechanisms, be it under the umbrella of the executive power, be it with the Ministry of Exterior. In different countries, it's different structure coordinating the implementation of international recommendations, but countries are required to have national mechanisms which push forward for the implementation of international recommendations. The only country in Europe that has such national mechanism is Portugal. Only one country. And Portugal is not the country that has received most international recommendations related, I'm speaking in general to human rights, not only on racism and the right to health. No? So there we say it's like something is going on. No? And the big question here is how we can have a collective voice on strengthening international obligations of states. And I'm pulling the conversation into this area because we also know how difficult it is for the European, and because of also mandate and no mandate mainly, that they have the European institutions do not have the power to shape what is going on at national level. But the international normative framework does have this power, okay? The problem here is that we don't have sufficient staff to be deployed in all countries and to do this type of job. Now, that's why we rely very much on this type of alliances to be able to reach at national level and to say, okay, there is your list of illustrative indicators on the right to health. You have one on violence against women. You have one on non-discrimination and equality. How we can start building on those with the National Statistical Institute in your country, with the Ministry of Health, with the Ministry of Education, with the National Commission for Eradication of Violence Against Women, with the Public Human Rights Institution, as it has been done already in over 16 countries around the world, with very good and very positive outcomes. No? Now, the methodology, what is important to mention here, is endorsed by probably 80% of the countries in the world that are signatories to international treaties. It's not something that was developed as a desk work by only 3 or 4 researchers from the High Commissioner for Human Rights and some other UN agencies that are like-minded and UN staff. No? It was a process, like the first publication of this methodology was made back in 2008. It can be downloaded or Googled with this abbreviation that you find up there, the presentation, you will have it. And it was developed by a group of experts from academia, from international bodies, from civil society organizations, treaty bodies, mandate holders, which examined all proposals that were received. It was very long-lasting, consultative, participatory process. No, it took over 3 years to develop and then more than 3-4 years to validate before it was published, no, to come at the end of the day with the proposal that you have. And this went through the hands of probably over 700 people around the world, no? And then it was reviewed by WHO. There you can see in the slide all the UN institutions that made one first level validation of the methodology, and then the statistical division of the UN Economic Commission for Europe, the World Bank, the UN Statistical Division. No? So it really has a lot of, let's say, professional, academic, and expert support. Okay? So it's published in 2008. After this validation in over 13 events in 10 countries, with a representative of the executive, legislative, judicial power, public human rights institutions. No, I'm not going to keep on repeating them, but I just want to stress the importance of the participatory process that was done before coming with this methodology. And what does it give us? Let me just see how much time I have because I want to touch upon the FRA study. It gives us a proposal on how to transform existing statistics to human rights indicators. This is for what we use it. The definition of human rights indicator, we can skip it, no? But what we do here, give me just 1 second. Okay, I will stop. Just 1 second. Okay. What the methodology is proposing is how to draw the line between normative obligations of the states under the so-called structural indicators, no? Which reflect state obligations to comply with international human rights standards, and how to do this measurement already through statistical language and statistical lens with the so-called process and outcome indicators. The process indicators that we have are those who directly trace the state efforts to comply with human rights obligations. If we go to the right to health, for example, and I think this is in this is table number 3 in your document. Okay, you can see that the process indicators, illustrative, proposed here, in fact reflect everything that a state should be doing in order to implement the right to health. Okay? Everything related to sexual and reproductive rights, to child mortality and health care, to national and occupational environment, to prevention, treatment, and control of diseases, and to accessibility to health facilities and essential medicines. So the big input that you have from this methodology is that it translates you the normative obligation into the so-called attributes that you see in the columns here, and tells you the minimum content that you should reflect in your statistical systems, be it at level of National Statistical Institute or administrative registries, have to reflect on these attributes here and have to cover the minimum components presented here as process indicators. For example, we have, and I'm just reading randomly one of the most controversial ones related to sexual and reproductive rights, is the medical termination of pregnancy. Okay, here we're speaking about abortion. So to all the voices in different contexts that will say, I don't want at any moment to measure and register abortion in my country, you see that from international normative obligations, it's something that the states should consider how to operationalize and how to measure. Okay? We don't have the time now to go through all the proposals of minimum components that should be measured, but those are already here. And in the guidelines, on how to develop national action plans on anti-racism that the Commission produced, they make reference to this methodology. Now, the problem that we have is that it hasn't been able to be lowered at national level, and we don't have the voice that can reach at national level, and that's why those spaces are so important, and go to states and start working with the matrices on illustrative indicators and see, okay, how do we operationalize this for your country, and which is going to be the responsible entity to monitor this indicator, which is going to be the responsible entity to register the data. Is it going to be the public health sector? How are we going to monitor, now that we are with the topic of abortion, how are we going to monitor what is going on in the private health sector? How are we going to monitor all the health complications that come from the attempts that women make to self-abort at home? Because these are in fact the realities that we want to reflect in our human rights indicators. And then we have outcome indicators, which are much less numerically wise than the process and the structural indicators, that give you one big picture on what is the outcome of all governmental efforts to develop statistics. And as some examples of outcome indicators here, we have, for example, proportion of live births with low birth weight. We have perinatal mortality, we have maternal mortality ratio, and on the top of this minimum content, now that I'm with the attribute on sexual and reproductive rights, when we start contextualizing these indicators for each particular country where we want to measure, what do we have to include? We have to include all issues that are relevant for the country, because this is part of the methodological proposal. Part of the methodological proposal is like, you have to make this contextually relevant and you will make it contextually relevant based on also all requirements coming from academia, from civil society, from victims, all requirements that come from the voices that are raised in spaces like this and translate them into statistics. And one uncomfortable example, I know it's a topic that was also raised yesterday on the so-called obstetric violence. How are we going to operationalize this? How are we going, again, racism, how are we going to operationalize it? Not because the topic is uncomfortable, means that we have to leave it outside of our statistical systems, because we know that women, and then the methodology is asking us to comply with cross-cutting norms and principles. And one of the cross-cutting norms and principles is, how are you going to reflect the most vulnerable populations in statistics? And this is much going far beyond mere disaggregation of data. How are you going to reflect the instances in which the Roma woman or the woman of African descent or the Latin American woman who is in irregular migratory situation, reaching the health sector, being mistreated by medical staff? Because we know this is happening. It's not sufficient to say, we cannot speak about obstetric violence because we don't know what it is, when we know that this happens and that we know that women and newly born children are losing lives because of similar practices. Now, the human rights perspective here it is that we don't need a lot of cases in order to push forward for the registration of data. From statistical point of view, those of us who work in the statistical field know that it is extremely expensive to make representative surveys. Every time when we want to include a new variable in our statistical systems, this implies a lot of budget. No? Unfortunately, from human rights perspective, our argument is it's sufficient to have one case. And if you have one case, you have to have it recorded somewhere. And it has to be recorded in such a way that you can reflect it in your policy later on. Okay? So these are the components. And as I was telling you, of course, there is a lot of statistics behind all this. But the strongest messages that you are going to read in our methodology are messages that every person can understand by the mere fact that we are humans dealing with these topics. I mean, does that make sense? More or less what I'm saying. It's not very complicated to understand the message here. Try to translate human suffering and try to translate what in statistical terms will be called numerically insignificant occurrences in data systems at administrative registry level. No? So here we have the attributes per different rights. One thing that we try to assure with our methodology is that they are mutually exclusive, okay? And that they reflect the essence of the normative content. Okay? The right to health, we already reviewed it briefly. And I want to come here to before I continue with very short discussion on some of the limitations that we are seeing of the FRA Being Black in Europe study, which is amazing, let's say, baseline approximation, I would say, on racism in Europe. Why do we say that it's baseline approximation and something more has to be done? Okay. Because from statistical and methodological perspective, the best data sources that we have to use for measuring the level of implementation of human rights are the ones that you see here in the second column. Okay? Not event-based data, not perception and opinion studies, and Being Black in Europe falls here, it's perception and opinion study, and not expert judgments. Okay? These three, events-based data, perception and opinion studies, and expert judgments are information sources that are additional to the core obligations of states. And I'm saying they are core obligations of states because it's only the state responsible for implementing human rights. It's not civil society, it's not the academia, It's not the experts, it's not the victims, it's not the decentralized institutions, it's the state with its central institutions responsible for the level of implementation of human rights and responsible for reporting on this level of implementation. Okay, and here we have to assure already generalizability, validity, and reliability of the information that is being collected and presented. In this sense, here our methodology is extremely firm, and the same happens with the methodology of the Organization of American States. Like they say, this is already the non-negotiable, and I would say the core of the methodology that you can read in a document of over 190 pages can be summarized based to what you see in this slide, which is what our data sources should be, where the efforts should be invested, where the money should go. Okay, and this is socioeconomic and administrative statistics on the first place. And to all the voices that say we should be avoiding measuring racially related issues because of privacy issues, let's remember that here we are speaking about statistics. When you are registering, when you have good statistical systems, and when you have good administrative statistics, you don't have personal data there. Of course, we have to be very much in charge of putting all the logs of not having personal information. And there are, again, I insist, over 12 countries in the world that have been doing this with the human rights indicators on how not to have personal data in those administrative registries and socioeconomic statistics. It's absolutely possible to do it. For us, the argument of personal data is not a valid one. This is the political argument of some countries of why we should not collect information on racism. The second thing are administrative data, okay? The third thing are statistical surveys. FRA Being Black in Europe is not a statistical survey, okay? And the last one are the censuses. So the best efforts should come, who is making those type of statistical surveys and censuses. These are the national statistical institutes of countries. So our messaging here should be, how do we strengthen statistical surveys and censuses to include all indicators related to racism, related to at least 15 rights, social, economic, cultural, environmental rights, and also civil and political rights, okay? And indicators that we are developing should be, let me come back here, should be relevant and reliable, should be independent in data collection methods, should be, well, universal globally, this we know it, should be very transparent and in its methods of collection, should be possible to be subjected to desegregation and provide for comparisons across time and across regions. Here we should remember that all indicators should be reflecting information on all relevant population groups that we want to measure, should be able to make small discriminations between spaces. This means that we don't need only national level indicators, because usually behind the national level indicators, we are hiding where the big problems in a country are. Indicators should be able to be disaggregated at whatever the administrative structure in a country is, city, municipal, regional, state level. These disaggregations, we must have them. And all information should be made public and transparent at any moment. So now that you see this, you realize that it takes a lot of time to develop these sources of information, okay? How long has it taken us, for example, in countries like Paraguay, Brazil, Chile, Mexico, which was the first country where we started launching these efforts? It takes for one data system, for example, on the right to health, it took us around 2 years to make the negotiation and the substantive discussion with National Statistical Institute, Public Human Rights Institution, Ministry of Health, all relevant stakeholders, Ministry of Interior, the national body reporting on implementation of international recommendations. all these structures are there. It took around 2 years to produce the first data set. Okay, and considering that, for example, Mexico has one of the top 5 level in the world statistical institutes, this is something that we have to take into consideration here in the European context. How long is it going to take us to do it here? I know that I'm running out of time. I just want you to give me just 5 more minutes or 7 more minutes, please, I beg you. No, because it's a lot of information. Usually those are academic courses, no introduction to quantitative methods and human rights indicators that I'm always trying to.
Sorry, we also have questions online.
If you,
Yeah.
if you could get into the FRA report.
Yeah. I know, I'm very aware. No, and we have we have a coffee break. So, yeah, and I can say also with the people online. Yeah. No, now bear in mind what I mentioned, like a couple of the core messages. We have illustrative indicators on all human rights. We have the messaging on cross-cutting principles. Okay, which means all rights for all people should be reflected in statistical systems and administrative registries. If I have to summarize it in 2 sentences, more or less is this. It should be reliable, it should be valid, and it's quantitative. Bear in mind, we're speaking about quantitative data, not about qualitative data. The qualitative comes on the top of everything that is going to be developed here. Okay, and you saw the data sources. Now, what is our major consideration regarding the FRA being black in Europe? It's absolutely amazing illustrative study, no, that fills a gap that we have here in Europe, but what are some of the issues? Data there are not generalizable. You cannot generalize on the European context based on 12 or 13 countries that have been studied. The sample is very small. Those of you who are statisticians here know that with a sample of there between 6,000 and 7,000 people, if you want to make more disaggregations or you want to start making inferences between the relationship of right to health and right to housing as reported there, for having generalizable outcome results, you need to increase the sample size. Okay, so there we have a statistical problem. The studied human rights issues are limited. We have harassment, violence, physical violence, police stops, discrimination, education, something related to health, employment, housing, social inclusion. Remaining human rights are not covered for obvious reasons. Like they don't have the core mandate of doing it. They are not National Statistical Institute. They don't have the money to do it. Please don't take me wrong. This is not a criticism to the study. These are just some of the limitations that we have to consider. There is no possibility to make intersectional analysis of human rights issues, and you will not be able if you don't start exponentially increasing the sample size here. It's perception study. The biggest problem that we can discover here is that what they measure is the feeling of being discriminated, okay? And here the issue starts because of measuring feelings and perceptions. I'm not underestimating the importance of feelings and perceptions, is that it's very difficult to interpret the findings, and you cannot build public policy exclusively based on perceptions. I'm not saying don't make this, but it cannot be the exclusive data source. And one example, they say people who experience racist harassment, their number decreases with age. Here I would say, and all of you who have studied either medical science or psychology know that, and yesterday we spoke about this, that with age people internalize racism, and that with age we start fighting less, and that with age we start having, how do you call it, like tougher skin. So what is going to affect a younger person, and the younger person is going to fight when you're 50, 60 or more, you just drop it and you do not report it. So the result that they present, the risk of experiencing racist harassment decreases with age. I would say the interpretation is that not that the risk decreases, is that people just do not report it. And even worse, people might not perceive it. But that does not happen, that the health outcomes are not worse, considering also all the life-related or age-related changes in people. The reasons for not reporting contradict the findings. So the findings tell you, you have increasing incidences of discrimination in Europe, racial discrimination. But when people start reporting on why do they not go to report to relevant public institutions, they say the incident is minor. And there we have a contradiction. No? People say, I deal with it by myself, with the incident. Okay? Another issue that we have here is self-perceived health, and this is only on people of African descent. Self-perceived health is 81% of the population, studied population of African descent says we have very good health, which I will say something probably very unprofessional, but my first reaction to reading this result is it's not possible. It's not possible that 81% of the people report their health as very good. There is either methodological issue or because of the perception study, exactly how do you feel, I underrate how I feel. And this is, by the way, higher than the perceived health of the general population in the studied countries. But what is the contradiction? Later on, Fra tells you 1/5 of the people tell you that they have long-standing illness, 18% report long-standing illness, and 18% report long-standing limitations in their usual activities. So you cannot be living with a long-standing illness and long-standing limitation in your usual activities and report that you have very good health. Or I'm interpreting it entirely wrong. No? Unmet needs for medical examinations. In some countries, people of African descent have 50% higher unmet need for medical examination than the general population. Now, this 50% plus this 18 contradict the 81% that is up here. How do you remedy this with administrative registries, which is usually the case? You will remedy it if you have a good administrative registry in the hospitals, in the clinics, in the medical services that you have, outreach medical services that are reaching remote communities, and that register types of complaints, types of response, type of diseases, type of treatment, everything that is stated here by the indicators, how much it costed, how much was out of the pocket cost for the people. And there is exactly how you jump from the perception study to the completely anonymous registration of information by one sector. And we can continue like this. And by the way, I will extend through Berenice. In October, we are going to have, I don't know if 1 or 2 days, very detailed training on how to construct indicators with her and sister organizations and interested colleagues, how to make those sorts of interpretation, how exactly to approach institutions and start expanding their administrative registries. Sometimes the question is also related to how do you see with those who develop the systems, with those who work in informatics, and tell them, open me one additional variable here. And I need you to have these drop-down menus for me to be able to register. And what do we pull in the catalogs there of registration? We pull, for example, national catalogs of diseases that exist, national catalogs of crimes. We link also this we did it in Mexico, with the data of the coronary service. Yesterday, we spoke about this, but the link of the health sector in Mexico that we have between health sector and the forensic services is straightforward. Like you can make the analysis of who dies and why and for what reasons. And there we intersect all the issue of violence against women, femicide, and gross human rights violations of women and children. No? So we have health sector, forensic system, justice administration, prosecution. Everything is interconnected at administrative registry level. In countries which have much, and with this I finish, in countries which have much more limited resources than countries in Europe. So I'm very sorry that I couldn't enter into more detail, even though this time we had more time than last year. Last year we had only 15 minutes. And always I managed to give you a very, very general overview. No, but the message is there is a methodological framework. It's not difficult to do. At the end of the day, it's resumed to what? It's resumed to political will and to have voices coming from statistics, from policymakers, from civil society, from academia, no? Coming together, sitting with whom? With the statistical departments of institutions, reviewing what data they are registering, and finding the budget to start stepwise recording more information, preserving the privacy of people. Is it possible to do it? Absolutely possible. Does it take at least 2 years? Yes. So this is on my side, and we will continue with this all throughout the day.
Okay, do not go away quite yet. You managed to give 10 minutes for questions and comment.
Cool, guys, yes.
Thank you.
Thank you. Kurt Geisert, I'm one of the guys in the House of European History. Thank you, Mila. You were speaking like a university professor. You mentioned that Portugal is the only member state which follows all UN recommendations in this field. Has it to do something with the gentleman behind you? Oh.
Well, that all countries give follow. All countries give follow-up.
Yes.
No, well, the gentleman behind us before this, he used to be the head of the UNHCR, and the national mechanism for follow-up in Portugal is I wouldn't know.
Mhm.
Honestly speaking, no, but it's a good thing to explore, and all countries give follow-up, but national mechanism is that as interlocutor between UN treaty bodies and institutions which have to be in charge to implement the recommendations has to be established in remaining countries as well. And it doesn't cost, it usually it's a conglomerate of representatives of different institutions.
Great.
Yeah, thank you very much for your presentation. But my understanding of English is 50%, but I understand globally because, as he said, like a master. Very good. Thank you. So my question is this. How does it work with hate speech?
Mhm.
Because when I was born, I was a baby, they told me that there was some kind of hate speech, people were killed. Decades later, for the same purpose, people were also killed.
Mhm.
In 1922, people were killed. Recently, there were more killed people for the same purpose.
Mhm.
So I've been going in the UN, trying to find the way this kind of problem
Mhm.
can be resolved, because we have as you said, the UN and member states, something like that. But the question is, how does it work to find solution with this kind of problem that come regularly?
Ooh, I think this goes far beyond the conversation that we have here. Now, how to eradicate this problem? And you mentioned about hate crime and hate speech. I will try to bring it back to two answers. Like first, I don't think any of us is in capacity here to respond. How can we eradicate such an issue? No, it's like the shared efforts that we have since ever are exactly this. No, guarantee life and security and liberty of people, and let me bring the topic to data. Regarding hate crime and hate speech, okay, there is a working group here at EU level on hate crime and hate speech, where big effort is made also to record the incidences of hate crime and hate speech, and also the regulation of everything that is going on online. No, this is a topic that we will not cover now because it will take also days in itself to present what the working group is doing with very good results. Now, regarding data, there is, if you read our matrices, because we need it, no? We have illustrative indicators on life, liberty, and security, and also on threats. So everything related to life loss, killings, enforced disappearances. Also, there is illustrative indicators on torture. I'm speaking about more countries, no, outside of the European context for which these matrices have been very, very useful. No, this will serve as the first step of trying to start monitoring what is going on in the countries. One parenthesis that is important to open here, and we addressed this topic a couple of weeks ago, it was in the NR's General Assembly meeting, is the establishment of national protection mechanisms. Okay, in Europe, there is already the discussion. I don't know, probably here I'm not exactly in my waters. Tanya probably will have more information. I know that at EU level, there is already a discussion of how to create protection mechanisms, no? For people who are raising their voices, no? For people who are addressing those issues. And specifically organizations or human rights defenders, which are advocating for the rights or protecting the rights of vulnerable populations, Muslim populations, people of African descent, refugees, asylum seekers, etc. I'm bringing this topic to your attention now because there are established national protection mechanisms in countries like Peru, Brazil, Colombia, and Mexico, which have a lot of success. And there we have implemented with the mechanisms, they are nationally run mechanisms, they are of the state, no non-governmental structure has the power to have such protection mechanism, okay? But what we have done with them are exactly the administrative registries. Our office and with a couple of colleagues, we were in charge of the protection mechanism in Mexico. We established there 136 indicators on the impact of the mechanism, okay, in deploying emergency actions, emergency protection, and ongoing protection for non-emergency cases. Okay? So administrative statistics developed and administrative registries for national protection mechanisms in those countries that I'm mentioning to you, no, Mexico, Colombia, Brazil, Peru, up to my knowledge, are based on this methodology. Does it solve the big problem? Of course not, no, because this is the permanent dancing between state response and UN and civil society response to increasing all the time organized crime and generalized violence that we have in the region.
Okay, I think we have, thank you. We have a question online, Thomas?
If we can answer it very quickly.
Yeah, yeah.
Can I have the mic? Yeah, we have one question online regarding also an interesting point, more about the data collection part. So the question from online is, how do you address, it's about the indicators, how do you address human rights indicators in developing countries among women and children? And a related question also was in rural areas. So we're really talking about the collection and the indicator design in fields where collecting the data is often a bit more difficult.
Yeah. Again, I will give the more positive and the more and the less optimistic response. I will start with how do you go to rural areas and how do you go to rural and remote areas. And again, no countries, well, in fact, almost all countries outside of Europe and Anglo-Saxon world are those countries. How it was done, for example, in the context, not to give you always the example of Mexico, no, because I come from there, it's kind of obvious, I think, so many years working there. Colombia, no? Colombia, with the follow-up of the peace agreement in 2017, which is looking at measuring the reincorporation of the ex-FARC, the ex-militants, okay? Those ex-FARCs were relocated in remote areas, in rural areas. Now, remote and rural areas in Latin America and Asia and Africa is not the rural area in Europe. There we're speaking about the deep jungle, the deep selva, where you might take up to 24 hours, not even with a vehicle, to reach the community. Okay? Plus all the danger that it implies, physical danger to go there. So these are the areas in which we have to measure. How is it done? First, I will not be, I will not give you the sugar-coated version. It's done with a lot of money. A lot of funding. You need to have the political agreement of the country that they want to deploy units for monitoring the situation, their impact in those areas. What we're doing is, they're giving me a sign to stop. In those areas, we are doing practically small censuses in the population. You need to have the funding to reach those areas and there make a whole population, because we're speaking about populations of 1,500 people, and you can make a mini census in this area. In developing countries is the same story. You need to find one or two institutions which would be willing to jump on the initiative of developing indicators either on one human right or within the administrative registry in one institution. There, our suggestion, and that's how it has worked in many other countries, is find the one successful institution that can start bringing on board remaining institutions. No? And again, this brings back the whole discussion to legislative power to give the funding for consecutive efforts. But very glad to continue with the colleagues online, know how it can be done.
Wonderful. Thank you so much, Mila. It's exactly 11:15 as well. Well done. So what I take from that, as I'm sure, oh, no, break. What I take from that is actually the importance of going to the source. The baseline source for all of this won't be the highfalutin politicians at national level. It's going to be the Office of National Statistics, the census, and the registry. You just made my life so complete, Mila, because I can just ignore a lot of things now and go straight to the source. Thank you, thank you. So there's going to be a break now until 30. Yeah, until 30. And when we come back, we're going to continue our deep dive. And this time actually start looking towards quantitative equality data collection. And that is going to be from our colleagues primarily from the Amsterdam delegation. So I'm really looking forward to some practical inputs as well, from how do you move from getting the right institution on board to how does it actually work in practice as well. So, or not, as the case may be. So see you all back in about 15 minutes. Get some coffee. Thank you.